It should definitely be a choice. We shouldn't be forced to put something in our bodies that we have no idea how it's going to affect us, because it affects everybody differently.
An IU Health employee waiting to find out if she will join a group of more than 100 people who lost their jobs for not getting vaccinated. The deadline for staff to get the shot was September 1st. Good evening, everyone. I'm Phil Sanchez.
And I'm Sierra Hignite. Meanwhile, Eskenazi employees have just 2 hours left until their vaccine requirement goes into effect. News 8's Demi Johnson is in the newsroom for us tonight. And Demi, the IU Health employee that you talked to says that the requirements couldn't come at a worse time.
Yeah, she says hospitals are already facing staffing issues and mandating the vaccine won't help. Just last week, IU Health lost 125 employees for refusing to get the shot.
It's very stressful and it's sad because there's a lot of people that have put a lot of time and effort into their careers.
Tiffany Huddleston is waiting to learn her fate.
That is unknown at the moment. I do not know.
She's been suspended from her job in the med-surg unit at an IU Health hospital for not getting vaccinated. Huddleston says she isn't sure why she wasn't fired with everyone else last week. But before the deadline, she tried to fight the mandate.
I applied for the exemption like multiple times for medical and religious reasons, and I got denied each time.
And when that didn't work, Huddleston says she suggested the company provide weekly testing for staff who didn't feel comfortable getting the shot. That was also an option President Biden gave to companies when he announced a vaccine requirement for businesses with 100 or more employees.
The hospital that I work at, they have literally in the parking lot right next to me the COVID testing place. So it's not like it would be an issue for any of the employees to walk literally across the street to get tested. And I find it very hard to believe that they would refuse to do that versus lose their job.
Having worked with several COVID patients, Huddleston says she knows the virus is bad. But for her personally, she says it's not the right time to get vaccinated.
It sucks because it's either risk your entire career and what you love to do, or let other people control everything that you're going to do. And it's just, if you don't stand up for yourself and what you want to do with your body and your choice, then it's never going to change.
The next 2 hospital groups with fast approaching vaccine deadlines are Eskenazi and Ascension. Eskenazi's, as I mentioned, is at midnight, and Ascension is November 12th. Eskenazi wouldn't say much about its process until after tomorrow, when they have a better idea of how many employees have been impacted. Reporting in the newsroom, Demi Johnson, Wish TV, wishtv.com, and follow us on Facebook.
Demi, thank you. Pfizer says that its latest trial of the COVID-19 vaccine for children ages 5 to 11 showed that it is safe and generated a robust antibody response. The company says that it plans to request emergency use authorization from the FDA soon. According to a Pfizer spokesperson, there were no instances of myocarditis, which is a type of heart inflammation that's been linked to mRNA vaccines. The data has not been peer reviewed or published yet. About 46%, though, of all 12 to 17-year-olds have gotten vaccinated. That's according to a CNN analysis of data released by the CDC. The CDC says more than 14 million adolescents have completed at least 1 dose of vaccine.
Starting in November, President Biden plans to lift the strict bans on non-essential travel from Europe and the United Kingdom. Adult visitors from the region would have to be fully vaccinated to travel to the United States and show proof before boarding any airplane to America. The delay in lifting the restriction is supposed to give agencies and airlines time to prepare.